in which you can recover various types of headache. You must know the process of needling and the process of indication of the drug. So both as allopathy physician for both for as a acupuncturist, for both as a physician, you can use this method very nicely and it gives very good results. It's the wonderful results which you will get to recover the patients. Next.
Thank you, sir.
This is called complex pain. It is a temporal area of the radiation of the pain. Partial headache, yellow, and corresponds areas to the radiation of the pain. So you will see the picture of the pain, where the pain is there. आप picture में देख पाएंगे दर्द कहाँ होता है और उसको कैसे recover किया जा सकता है. Both with dry needle and all. We'll use some acupuncture points, and those who cannot use, they can use the medicines which are prescribed. So it is for good for both those who are doctors, non-doctors, right? It is because of the disorder of the mandibular joint, ears, well as the pain is referred from the lungs, heart, and pericardium. The headache is due to hypertension as well as referred pain from the distendance of pylorus and intestines. So they are next. So generally we give it local anesthesia, 2 to 3 ml. Lidocaine is used, 2 to 3 ml dilution, and 0.4 to 20 mm. Whereas in acupuncture, you can write down GB 3132, liver 3, ST 36, write down the points. Liver 2, liver 3, GB 31, 32, SP9, SP6.
Good evening, Dr. Sastri ji.
Good evening. So local anesthesia is 2 to 3 ml, and the size of the needle is 4.4 m into 20 mm. Right? Am I clear?
Yes, clear.
Yes, sir.
Yeah.
Next. So temporal artery has to be palpated very carefully. You must study the anatomy very carefully of the temporal artery, and then you have to insert this injection in the temporalis muscles. This pain is near the temporalis muscles. Yeah, you will see the points where you can indicate this point. So instead of putting injection, you insert the needle and use brain pain. The pain will immediately go away. I will recommend the points both as a physician, both as a acupuncturist. Write down. Next slide. Be careful. There may be injury to temporal artery. So always try to be careful. Always use acupuncture, and acupuncture is much safer. Lidocaine can be used by the local doctor, but headache may not subside sometimes with lidocaine. It may have some side effect. Other medicines should be there, but with acupuncture, you can do it very easily, and it helps you very fast to get relief. So write down the points. Can you write down the points?
Yes, sir.
GB 31, 32. Liver 3, SP9, SP6, ST36, ST31. Sorry, ST34. Go to the picture. Next slide. Manual mobilization of temporomandibular joint is indicated. So you have to generally this pain comes over the temporal region. Manual mobilization like this is indicated. What? Or doing like this is indicated to reduce the headache. And some relaxation therapy. How to inhale? Inhale at the count of 5. 1, 2, 3, 4, 5. Exhale. 1, 2, 3. Inhale. 1, 2, 3, 4, 5. Exhale. 1, 2, 3. With this, your headache will subside. So I told you 3 things. How to use lidocaine, how to use acupuncture, how to use competent therapies. Ask patient about the grinding teeth at night. So if the patient always ask one question to the patient, what question you will ask the patient? Is he grinding his teeth like this at night? If he is eating from one side, like this, or grinding teeth at one night, it may lead to temporal headache. Right? Any
Yes.
questions up to now? Any questions? You can see where you have to insert the dry needle. First is the red point, yellow one, then the red, and the area of the pain distribution. You have to insert the dry needle over there. And at the power of 1, give brain pain. The headache will go away. Immediately it acts as anesthesia. The primary point is a yellow one. Complementary point is a red one. Area of pain distribution, you just palpitate and see where is the pain. And you will see the pain is gone. Within 1 minute, use the needle. The brain pain which we have made, it indicates lots of recovery in this case. So now in this point, you may ask me your questions. Allow others to open the mic. Does who want to ask the question? Please ask the question.
Sastri
Any
ji,
question?
yes.
Yes, please tell me, sir.
When you're using dry needles,
Sir.
that means you're putting in 4 needles.
Yes. No, you have to
And-
put this 4 needles and palpitate where is the pain.
Okay. And when you're stimulating, you hold the complementary point and you stimulate the primary point.
No, you have the primary point and use the complementary points at the frequency of 1 or 2. Be careful of the artery.
Yes, Sastri ji, it's very close to the artery.
Right? It's just nearby here. Just be careful. Insert the small needles. Small needles are there. Insert that or 1-inch needle insert. 5 into 0.25. Carefully do not go half of the needle. Insert and then stimulate. Pain will go away. Next.
Sir, what about the direction of the needle?
It's perpendicular, slightly oblique.
Thank you.
So it is occipital headache. Now blue color corresponds to the pain area. You will see the blue color corresponding to the pain area. Occipital headache, blue corresponds to the occipital area. Next. What way may be the reason? Craniovertebral joint disorders in the areas of the cervical vertebrae. So it is cervical pain, disorder of the nasal, maxillary sinus. Generally we see it. Pharyngeal tonsillitis, referred from liver, intestines, ovaries, and testicles. So this pain may be referred from liver, intestines, ovaries, and testicles. So here you can see TCM and allopathy integrates. You understood what I said? It may be the referral pain. So use local anesthesia 3 ml dilution, needle 0.4 ml into 20 mm. The insertion of the sternocleidomastoid and purple. See these things you can understand. So you should be very careful while you insert this injection. Rather, I'll tell you very easy point. GB 31, 32, SP9, 36, and 77.242526. And then the local point.
Please repeat points, sir.
77.24, 25, 26, SP9, SP6, stomach 41, and then the local primary points.
Excuse me, sir. My network is breaking. I didn't get it right.
Okay. Next. Next slide. The mobilization technique, glycation technique is very useful. I told you acupressure points are there. Always use occipital point. Feng Chi, Feng Fu, GB20. What is Feng Chi? I forgot the name of the Feng Chi point. What is the name of the Feng Chi?
GB 31.
GB31 and
No, GB 21, I mean.
GB21 and Feng Fu, Feng Chi, Feng Fu.
Feng Fu is GV 15.
Yeah, GB21, GB15, Li4, Li11, liver 3, GB24, GB21, liver 4, liver 3, GB21. Don't go for much for chiropractic technique because it may be because of the disc prolapse also. So chiropractic techniques are not advised in this case. Now we'll go to the primary points. Severe occipital headache in the morning indicates faulty sleeping position. You may have this headache because you may have a faulty sleeping because you may not sleep properly. The position of sleeping is not properly. So you may have this headache. Abdominal sleeping position may be avoided. Don't try to sleep avoid on the basis of avoid abdomen. Try to special neck cushion. Nowadays we have special neck cushion, cervical cushion has to be used because it is a cervical radiculopathy pain, cervicogenic pain. It is called what? Cervicogenic pain.
Cervicogenic pain.
Yes. Here you will see which are the primary points. Be careful with the 3 primary points. Insert the needles. Primary indicated points are the injection points. So never go for the injection because you are not an expert of injection. Use dry needle. So yellow color is the primary point. What is the point? It is now over here. Here. You'll place it, it plays very badly. So insert the these 4 needles with Li4, Li11, SP9, SP6, SP36, liver 3, stomach 44. And then you inject this needle carefully. You will immediately get relaxed. Yes. Now parietal lock. I am not doing any Zoom administration. I request of people, please take with the request. You must write down the name of the country and all. Now indication is what? Parietal lock. What it is called? Parietal.
Parietal lock.
Yes. So it is chronic parietal lock, pulsating temporal headache, pain accompanying the ear disorders, tension headache, headache triggered by hormones, and post-traumatic headache, PTSD. Because someone dies, you have so much headache, so much you go to war, you get this type of headaches, right? This is called parietal lock. Write down the points. SI3, Lingu Dabai, 88 for 20, 14, 15, 16. SP9, SP6. 88.4, 14, 15, 16. Liver 3. Give it 31, 32. These are because these of the mandibular joints, upper and lower nasal frontal sinus disorders involving zygomatic arc, inflammatory changes in the scalp. These are the differential diagnoses. Generally, this pain becomes of the mandibular joints, upper and lower. Nasal and frontal sinuses are also involved in disorders involving zygomatic arc. Local anesthesia 4 to 5 ml, needle point for to 20 mm. You can see the points now. Total, but generally it should be given only 3 ml. The technique is very difficult. So I'll teach you the acupuncture technique. So you may endure, since your anatomy is not correct, learn the acupuncture technique. Which are the points you can take? Especially in acupuncture point TB21, as in migraine, the additional injections may be performed at the exit of the supraorbital nerve. So you don't need to use it, use these points and use LI4 in both hands and use these points which are given in the picture. So you palpitate and you will see there's some points over here which are very severe. You can see. Triggering points. Trigger the insert the triggering point and the pain will go. Up to now, any questions? Any questions?
No.
G,
Yes.
you say the trigger point. Huh? Are you talk about the injection needle or dry needle?
Dry needle, dry needle.
Okay.
It is both used in injection needle and dry needle both. The technique is simple. Here you use local anesthesia, here you use the needle and the pain.
Okay, you say you use dry needle. Could you
Yes.
kindly explain the mechanism? How come you plug in a dry needle, the pain goes away?
You see the picture, you can understand the location.
No, I know, but can you explain the mechanism, how the pain goes away?
See, these are trigger points which are generated. So when you insert the needle, endorphin and corticosteroids are, which are itself induced in the brain, endorphin is induced, the pain itself subsides. So when you put an acupuncture point correctly in a correct location, what happened? This endorphin and all are released and the pain is reduced.
And how about like you have a hypertension?
Pardon me?
No, if you plug in some needle, people with hypertension, the hypertension goes down. So what is the mechanism, you know?
Tension is generally because of the anxiety. So anxiety release is released because of adrenaline. So when you insert this needle, adrenaline level goes down and slowly endorphin level and good hormones comes up and then the pain comes down.
So is the adrenaline that is causing the issue? Is it?
Yeah. This is the most common subject everywhere in the world. Occipital headache is like tension headache. Headache involving the area from the frontal heights, ear, all this area, frontal area, you will have a lot of headache. So it comes from the distal areas of the pancreatic points. The pancreatic points generally recover from 88.17, 1819, 2.88.17, 1819, GB 31, 32, ST 37, GB stomach 44, BL 64. So here is the pain what we use. This is not the pain, we call it brain pain, which we have made it. And then we insert the needle. And we insert it and then we do it like this. We stimulate it like this. Or you directly stimulate the pain. You need not to insert the needle. You stimulate it with the pain. The pain will go. Very easy technique. Stimulate with the pain. Why to take the risk of inserting the needle? Insert it with the what? Stimulate with the brain pain. What pain will you use? Brain pain.
Brain pan.
You need not to go for this. So since you are using this pain, there is no risk.
Good evening, sir.
Ah,
Sir, I'm Sumalata from India, sir.
yes.
My mother suffering from pain, sir. Sir, neck under the place, this way, sir.
Madam, you please first complete the chapter, then you will ask the question. Do you
Okay,
ask
sir.
question in between? When I tell you to ask question, then you ask.
Okay, sir. Okay, sir. Okay.
Here you will see which are the primary points. Here you insert, you touch it with the pen. This pen you take, which we have made brain pen, and insert it one by one. 1, 2, 3, 4, 5, 6, 7. It is the advanced brain pen you have to use.
Brain or advanced brain?
Advanced brain stimulation. Brain pen does not work here. Within 2-3 minutes, the pain will go away. teaching you those methods by which your pain will subside very easily. Next, pain in the region of the ear. You will see here you will have the pain in the region of the ear. A treatment case of autogenic vertigo, tinnitus, radiating pain from coronary recurring otitis disorders referring from other areas, particularly from the sternocleidomastoid muscles. So you will see the pain comes from here, refers from here, and it's very severe in nature. Next. It is because of the mandibular joint and it is because of the bite disorder. Vertebrogenic pain projecting from segment 3 or 7. So vertebra C or 7 is involved in the pain, cervicogenic. Generally, local anesthesia used, small amount of local anesthesia is used. Needle is same 0.4 mm to 20 mm, but generally I don't advise it. You can use it by the acupuncture point. Acupuncture points are same, both the hands LI4, LI11, in tongue, DO20, GB 31, 32, 81, 8.14, 15, 16. SP9, SP6. What are the points? GB 31, 32, both hands LI4, both hands LI11, one hand, one leg SP9, SP6, liver 3. Here you can see the primary points indicated in the injection point. So you use the primary needle like this and then touch with the secondary area. So your distributed area, you will see the pain immediately goes away. Use the pen. Best technique is use the pen. Don't use the needle. You may injure the artery or vein because your anatomy is not clear. Use a specialized pen. Don't use the massager pen. Again, after some time, you may have a very severe headache if you do that. Treatment of muscles, tendons, and ligaments. Yes. Parietal pain radiating towards the ear. So it is a parietal pain which radiates from the towards the ear. Chronic pain in the region of the upper teeth, including the hyperthermia of the teeth. So it radiates from ear. From the ear to ear. Can you see me?
Yeah.
Can you see me?
Yes.
Yes, sir.
Yeah. Next. So it is because of the reticular process, intracranial disorders, vasomotor, tension headache, and dysfunction of the masticatory system. This is the medical terms which you have to study when you study the typical headache. That is why I said anatomy is very important while you study all this type of situation. But I made it more easy. See the points, and it becomes very easy for you to understand. All you must understand which kind of headache it is. Next, local anesthesia, 3 same on side of the needle is same. I told you the risk is always of the injury of the artery or the vein when you inject the injection. So always use what? This pen. Use advanced brain pen. Which pen you will use here? Advanced brain pen.
Pen.
Which pen?
Advanced brain pen.
Yes. Generally, this pen is made by us, and we have made it in correspondence to the patient. The cost of the pen is very cheap. 7,500 rupees is the cost of one pen. And you can use this pen multiple times. You can recover multiple patients. So you can understand acupuncture is highly recommended. Instead of doing acupuncture, acupressure, use this pen. Here you can see the 3 points of the pen. Stimulate, put the primary point with this one, and then secondary and third. In 3 or 4 minutes, the pain will go away. What 3 or 4 minutes? Within 2 minutes. Insert the needle, write down the needle number, acupuncture points. It comes from the large intestines also. So I use LI1, no, LI4, both hands, LI11, 11.01, 02, 03. And these 3 points. You can see the masseter and the mandibular joint. So here you will see the pain is radiating towards the lower jaw, here, in the lower part of the jaw, and it is very severely painful. And occasional pain radiates from the center of the face towards the nose. So the pain radiates from the center of the nose. It is called vestibular or mandibular joint pain. So you can see how we recover this pain easily. Tomorrow I will show this point. This similar type of patient is with me, and within 1 minute I recover this pain. I'll show you how to recover this pain tomorrow by pain. Next. Generally, we use 1 to 2 ml of lidocaine or mastilar, but this is not advised. Go by the pain. See, pain and this gives almost the same effect. So why to take the risk of the injection? If something goes wrong, the patient may have a risk, but with this pain, you will never get any chance of getting any risk. It is safe and safe. So you can say maxillary artery can be injured when you insert the injection. But when you use this pen, there is no chance of injuring any artery. No vein is injured, and you can see the primary point of the pain. Generally, if the patient continues to grind such at night, you have this pain. Here is the primary point you can see. Primary point is integrated in injection point. So don't touch it with injection. And area of the distribution of the pain you can see in yellow color. Palpitative with yellow color. See here. Whichever is the trigger point, touch the pain, advanced pain. Stimulate for 10 to 20 seconds, and you will see the pain is gone. These are primary indicated for the injection point, but I don't prefer to go with local anesthesia because after 10 minutes, Jalokin pain will come again back, but this pain will not come back. At least it has 12 hours effect. Jalokin pain or lidocaine pain affects only for 10 to 20 minutes. Next. Treatment through nerves. So chronic affection to the frontal sinus, unilateral and frontal headache. You'll have a frontal headache. So what to do? It is called suborbital nerve. Supraorbital nerve. It is called supraorbital nerve. It is generally because of glaucoma and other affections, and also because of tumors. So sometimes you ask me, how do I know the patient is having tumor? By the indications of the disease, we come to know the patient is having tumor. All points. Next slide. You may injure the supraorbital injury. So never do that. Use this pen, brain pain or advanced pain, use it, and you will feel better. You'll get better in recovery in minutes. I'll show you tomorrow in my clinic how I recover headache if I get any patient of that. Generally, I don't get headache patients. I get only patients of severe paralysis, bedridden patients, coma patients. So this is the point where you have to what?
Supraorbital nerve.
The pen and then LI4. Pen, LI4, this one, I11. So it is called infraorbital nerve. Pain in the central region of the face near the second maxillary branch of the trigeminal nerve. You will see the branch, second M2 branch. This is called the M2 branch. So even M2 branch can be recovered by what? I've been recovering trigeminal neuralgia pain with the help of this pain. Chronic suprainflammation and maxillary region which requires dental examination. Generally, you require dental examinations, whether you have an dental infection or not. But with the help of this pain, immediately you can subside the pain. I'll teach you a lot of points in this. There are a lot of slides. Next. Local anesthesia, we use 0.5 ml. It is 0.4 into 20 ml. See, this is not advised. You may injure any of the artery, you may injure the infravertebral artery, and you may risk the patient intravenous injections into the facial, and may also be avoided through pen aspiration. So you must avoid all these things because you do not know how to aspirate. Generally, just go by the what? Pen. Safest direction to treat all this direction is pain,
Pen.
which I made. That is why I made this pain, because in my clinic it is the safest technique. You buy this massager pen and all, you do not know what you create. After some time, the headache is so high, you cannot manage it. So it may be because of continued headache by the hospitalist and Simo message. Primary point is indicated and area of pain is distributed. So this is the primary point. Find the triggering point in this area near the ICR. Find the triggering points. Use the primary point needle and touch the triggering point. Within 2 minutes, the pain is gone. Use the advanced pain pen. Treatment through the skin. Chronic headache of unknown origin as well as the tension headache. So you will see how to remove the tension headache through this. Procedures. We'll know because tension headache is the most severe headache we have it, and we have a lot of things which we have to do. Local anesthesia 3 ml, needle 0.4 mm into 4.4 into 20 mm. So it is for the local doctors who knows it very well. There are physicians who know these techniques, how to insert. Risk is none, but even then there is some risk. So don't use it, go for the pain. So how to reject the tension headache? Write down the points. PC6, PC7, liver 3, stomach 36, 37, 88.14, 15, 16.
Excuse me, sir, can you repeat? It is too fast.
Li4 to 2 hands. Li11 in tongue. ST37, 36.
Also pericardium, PC.
PC6, PC7. Never try to use any local anesthesia because you are not a doctor. If anything goes wrong, the patient will die. But if you go in the state of shock, anesthesia is neither in. It may be having this xylocaine. Xylocaine creates sometimes a lot of side effects. So pain is the best solution. Put the pain, there is no risk. There is a lot of noise. Please mute the mic. So wherever you will find the headache, the palpitate that points like this, mark it and test the pain. You will reduce the pain immediately within 5 or 6, 2 or 3 minutes, 4 minutes. PC6, heart 7, Fengfu, Zhongfu, Li4 both hands, liver 3 both legs. GB 31, 32. GB 31, 32. Liver 3 both legs. These are the headache points. Red color is the primary headache and yellow color is the headache reason. So touch one by one this pain, advanced pain, and you will relieve the pain. Or use the Parkinson's pain. Parkinson's pain is very good for this area. Which pain? Parkinson's pain. I'll put some videos in the Facebook by which you can see. But I'm afraid because others do not know the techniques. It becomes very difficult what they do, what they don't do. That is why I say join maximum people, but then you don't take the chance. What can I do? You are the loser.
Sastri ji,
Yes.
where there is no Parkinson's pen, can the CP pen, the cognitive
Yeah,
pen,
you
be
can
used?
use advanced brain pain.
So can I ask a question, please?
Yes.
So can you just show us what does a Parkinson pen see like or look like?
See, pain, all the pains looks like same thing.
Okay.
But then, see, you and me look like same or not?
Yes, sir, we
Two
look
eyes,
like
one nose,
humans.
one mouth.
Yes, sir.
So
So
what
how
is
do
the
we
difference between you and me?
differentiate between the
See,
Parkinson's pen
differentiation
and
is,
the
we have marked the pain here with Parkinson. We write down here Parkinson. Yes, we have written here with brain. You see, brain. It has been used in 16 countries by more than 700, 1,000 people. Even Walid, Nigeria, everyone is using it. You can ask Walid. Walid,
Yes,
Anyone
Sastriji.
here? Walid?
Yes, Sastriji.
So Walid, are you using this pen or not?
Yes, we have about 6 or 7 people in Nigeria now, and we have 3 in waiting that we are
And
waiting
how
for
is the
Phoenix to
result?
ship. Alhamdulillah, very good, sir.
It
So
is
where
this pen
can
is
we,
Very
used in
good.
Hong Kong, Indonesia, Malaysia.
so where can we buy it? Can we buy it from you?
It is purchased from here only because we manufacture this pen in IITs.
Yes, sir.
It's a
Sure.
workshop in an IIT. So they manufacture this pen. Generally, this pen comes in the set of 4. You can buy one also.
Sure, sir.
Generally,
Thank you.
we have used this pen to recover paralysis.
Sure, sir.
But
Thank
now
you.
I have learned how to use this pen. While teaching, I came to know many people have injured the arteries. You people do not know anything about artery. You do not know about even the BMS has injured serious occipital artery and all. So how to overcome these things? We overcame with the pen. There is no risk. No government can stop you from using this.
Sure, sir. Thank you.
It is a stimulating pain, but don't go with the massager pain. Massager pain is different. This is different. Internal, what matters is the internal circuit or how you make it. Because brain is made of 2 things, electricity and chemical reaction. Headaches and all, they react because of the too much impulse inside the brain, which creates what? Which triggers the headache. So when you use this type of pain, it reduces what? The triggering factor. Once you reduce the triggering factor, the pain is reduced. So from there, you will also learn how to recover cervical spondylitis and all in coming classes.
Yes, sir. Thank you.
May I know speaking? Hello? May I know speaking? May I know speaking?
Hello, madam, please say your name.
Sir, this is Lodha from Pune, India.
Oh. Always be careful because there are a lot of arteries and all. If you injure single artery also, the patient may die. So
Yes, sir.
always go for the safest direction. We have seen many cases coming in Pune, still that case which was filed that time in Pune, 6 years, 7, 8, 9 to 10 years back, still running and the High Court has not given, has not,
Yes, sir. They've not given a verdict yet. You are right.
yeah, not only verdict, the patient is still suffering. So it is better that you go with the safest technique until you are mastered the technique. Better while you use your hand and all. Use
Yes,
simple,
sir.
see, needle also create impulses, right?
Yes, sir. Yes,
This
sir.
pain also create impulse, right? Use
Yes, sir.
impulses and the pain will go.
Sure, sir. Thank you.
Next. Class hour. In hour, I have taught you about the most difficult chapter called pain management of headache. There are 26 types of headache, out of which I have created many types of headache with acupuncture points, putting acupuncture point and needling in the putting the pain recovers the pain very easily. I have recovered large number of migraines with this pain. So I am confident it will help you. You must only master the technique. You may ask me the questions.
Good evening, sir.
Yes.
Sir,
First say your
my
name. Who are you?
name is Sumalata from India.
Yes, Unmalata, tell me. From which part of India? India is a big country. Which part?
Sir, Hanamkonda, sir.
Oh,
Hanamkonda
please
district.
tell me. Yes, please tell me.
Thank you, sir. Sir, my mother was suffering from neck part, sir. Neck place, sir.
So very
I will-
simple technique I can teach you, but the problem is you don't have the pain and you do not know the techniques. First of all, you must learn. So
Sir,
the
I will
learning
showing,
is
sir.
very difficult. So I teach you a small technique. Palpitate the point and find out which is a trigger point. And then use
Okay,
this
sir.
pain. You know what is
Sir, I
trigger
will
point?
showing. Sir, I will showing, sir. This, she is my mother, sir.
I'm not saying with your mother. What is a trigger point? Do you know?
So this place was very secret,
Yes.
sir, right?
So, yeah, there are primary points over here, especially here.
Yes, sir.
So, putting
Totally
the pen
pain,
over here
sir.
and
Totally
stimulating
turned
here.
on face, sir.
You hear what
Okay,
I am
sir.
saying?
Okay, sir.
Putting the pen over here,
No,
here,
sir. No,
here.
sir. Oh,
1,
yeah.
2, 3.
Okay, sir.
And then touch your finger here. You
Okay,
will also
sir.
feel some impulse.
Okay, sir.
1, 2, 3. Put the
Okay,
point
sir.
on LA4, both the sides, and you will
Okay,
see
sir.
the pen is what?
Okay, sir.
Gone in minutes. The benefit of
10 minutes.
acupuncture is, but you know, even the orthopedic surgeon has learning these techniques because people don't want to use painkillers. Now they are saying we want alternative, we don't
Okay,
want
sir.
painkillers.
Okay,
Before
sir.
saying
Okay,
okay,
sir.
you try to hear me what I am saying.
Yes, sir.
That even orthopedic surgeons and all, they don't want to use this because they may create a side effect. Now the side
Yes,
effect
sir.
is what? Lidocaine, all these things, they may injure
Yes,
the
sir.
artery. Sometimes even the little carelessness may injure the artery. And you may have what? Complication. But when you
Yes,
use
sir.
this type of pain and you
Yes,
touch,
sir.
what is the complication you have?
Yes, sir.
Do you have a complication? You did not
I
understand
can't
what I.
understand, sir.
Do you have a
Yes, sir.
complication like this? One,
I have done acupuncture.
what you are? So simple
Sir?
technique I will teach you. Find the trigger point. Find out the points which are very painful. Mark them.
Yes, sir.
Here, here, here. You mark them. And then use
Yes,
this
sir.
pen.
Yes,
Hide
sir.
this pen and use them.
Yes, sir. Okay, sir.
And where is the main point? Find out. She's having the main point here now. Trigger it.
Okay. Okay, sir.
And the pain will go away.
Okay, sir. Thank you, sir.
Thank you so much. I
Thank
hope
you,
you
sir.
understood something.
Okay, sir. Thank you so much, sir.
See, the problem with you is that you have not studied the subject. How can I teach?
Okay. Full explain, sir. Thank you so much, your class, sir.
Anyway, my duty, whether you understand or not, it is my duty to teach.
I have understood, sir.
I'm only afraid you don't injure the artery. Because yesterday one of the physician injured the artery and we had a complication in the theater and then it was a very difficult movement
Okay.
because these are brain arteries.
Okay, sir.
So using the pen, you can see the pain goes immediately.
Okay, sir. Sir, is this pain? Is this pain also? Yeah. It does. Yes, a pressure point, sir. No?
Yeah, in the pressure points, right?
Okay, sir.
You're
Okay,
putting
sir.
too much pressure points on the pressure.
Okay,
Use the
sir.
pain
Okay, sir.
and it's gone.
Thank you, sir. Thank you so much, sir.
And it is a lifetime asset. With 1 year warranty, you get 7,500 with courier charges. It's a lifetime warranty.
Okay, sir. Okay, sir.
Buy at least 3 pens. What are they? Brain, advanced brain, and Parkinson.
Okay, sir.
Which are the 3 pens I said?
Sir?
Brain pen, advanced.
No, 1 minute, 1 minute.
and Parkinson
He's
one.
saying, okay. Which are the 3 pens I said?
3 pains, sir.
Which pen?
Next, sir. Neck part.
You did not hear anything, whatever I said.
Yes, sir.
I said brain, Parkinson, and advanced brain.
Okay, sir. Okay, sir. Brain, sir.
Brain and
Brain, sir.
you don't know anything.
Brain Parkinson and
Advanced brain.
advanced pain.
Write down and give. I don't know. Anyway, she will not use also because she does not know how to use.
Sir, cervical up to brain, sir.
What did I say? Did I say cervical up to pain? I say where is the pain? Touch the trigger point and remove the
Okay.
trigger point with the help of the.
Okay, sir.
She misheard about pain and pan.
Fine. Okay. Okay, ma'am.
If you have any doubt, you please
No,
ask
sir.
her.
No, sir. No, sir. Thank you so much, sir.
I don't know what you understood. 10/0.
She's confusing in pen and pain.
Yes, still confusing you in pain and pain. Pain, P in pain, and PAIN, pain. Pain is this. Pain is this.
Yes, sir. Yes, sir. I understood, sir. Acupen.
Acupain, best word you gave me. Best term. Acupain.
Oh,
But don't buy the massager pain.
okay, sir. Okay, sir.
Next.
So excuse me.
Yes.
Good evening, sir. Sir, one question, sir. One patient with overthinking, he's having the problem of overthinking, and because of that, he could not sleep, sir. Means his work is disturbed because of it.
So you have to see the history of the patient. Generally, because there are over stress and business stress is there. Generally,
Yes,
we use PC6, heart 7, liver 3, ST36, ST37, and the trigger points of the head.
sir, will you please repeat the point, sir?
LI11, LI4, 36, 37,
11, 4, 36, 37.
36, 37, PC6, heart 7, liver 3, and trigger points of the head.
Thank you, sir.
More questions? Any more questions?
Good evening, sir. This is Anand Maurya from India. Sir,
Oh,
can we
Maurya ji,
use,
please tell me.
sir, can we use any pen on TCM point, for example, Li4 or something other point?
No, no, no. See, you have to find out why it is there. Anand Maurya, can you place me instead of you in your job?
So, what, sir?
Can I replace you in your job?
No, sir.
No, sir.
Okay, if you can do it, I'll be very happy. I don't want to work here. You put me in your job. I'll be more happy to recover your patient. You come here and treat here. Possible? See, each pen has an impulse. Otherwise, any pen can do anything.
Yes, sir. Yes, sir. I am agree. Each pen have different frequencies.
And you are working with the brain. See, you have seen the complication of the brain. We are very much afraid of using even a small injection, lidocaine injection. It may create so much complication that the patient may. We simply one had a patient of what you call MS, multiple sclerosis. We gave him a paraspinal. Next day there was severe headache while sitting. We thought it is CSF leakage. For 5 hours I did not take the class. Words were not coming out. I thought I made a mistake. But then we spoke to the laboratory, we saw everything, we checked everything very finely. There was no leakage, nothing. And then we found she had a severe headache during multiple sclerosis. I could not recover it because I never understood all this. But when I made the research, I found out these points. And then I started teaching you that even in multiple sclerosis, this type of treatment is very helpful. By this pain, you can also help cervical spondylitis and all. That classes also I will take in coming time. But I request you to bring 200 people so that at least some people understand all these things.
Yes, sir, we can try.
Yeah, you put in different groups now.
Yes, we can circulate the message.
Yes, at least you put in different groups. Am I asking you to advertise personally, give you a personal phone call? No, just copy and paste in different groups. That's all. And tell them that we are my Facebook profile.
Yes, sir, yes.
Copy my Facebook profile and give them. There are 250,000 videos. At least they will learn something that doing too much exercise, doing too much all this may create so much pain. Now you, for example, even there, this boy found when the tongue acupuncture can help, especially tongue acupuncture helps with palmar diagnosis. The person who are teaching here, they do not know what this palmar diagnosis is. How will you learn? Your first two also went there, I saw that.
Yes, sir, yes, sir.
So it's no use. At least you should consult before going what to do, what not to do. If you are so mature, why to ask, why to take me as a teacher? Don't take me as a teacher. Go and do whatever you like. Play experiments with your. Can you teach tongue acupuncture in 2 days?
No, sir, it's not possible.
Did I still complete it?
No, sir. It's a very long subject, sir.
Tongue acupuncture, tongue used to take 4 years, 5 years, 3 years to teach this subject. I've written a book. I took 4 years to write this book.
Yes, sir.
I'm the first writer of tongue acupuncture. I don't understand why you people are thinking so easy. Acupuncture is 1 day subject or 2 day subject. One day when you destroy your patient, then you will know that you have done a very big mistake.
Actually, sir, those people are involved in the sports activity. They prefer dry needlings or some tongue points.
So
Many,
one thing I tell you, this pain, now what did I teach you? You have a severe headache because of this stress, right?
yes, sir.
Within 1 minute, you can reduce the headache or not?
Yes, sir.
Can't you reduce the trigeminal neuralgia in 1 second?
Yes, we can reduce now, sir.
Yes, I have reduced it. The video is there, the patient is there.
Yes, 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 we too.
Why to operate? Why to do neurosurgery for that? I was thinking of teaching you how to embolize tumors and all, brain tumors, but your level of knowledge is so low that I cannot take this class properly because you do not know about arteries, you do not know about this. You have seen how slow you are in studies. Otherwise, how much things you can do in your village, town, cities, families. Just one thing you know, pregabalin, dolo. I've used
Thalcobamine, progabalin,
yes.
and
Now
dolo
70%
painkiller,
of the
something.
headache I've stopped using this dolo and all just because of this pain in my clinic. And after learning this, I became very careful and I've taught you this slide that yes, you use it, the pain will go away. I recovered 28 years migraine pain. Tomorrow I'm going to put the video. Her husband is suffering from ALS. She was having stress headache. Even during menstruation periods, her headache was very high. This time she did not have any headache. Try to recover the things, not to hold the things. You all have become like allopathic physicians. Not even allopathic physician. I don't know what you have become. Definition is not there. Sports injury cannot be recovered by tongue acupuncture. I have taught tongue acupuncture for 10 years. I know. Sport injury requires a process. Especially it is used by tuna. In karate and kung fu, you use a typical type of tuna. And then the pain subsides. Do whatever they like, what I will do. Learn this and that, do this and that, combine this and that. Instead of focusing, the biggest mistake of our science is what you know, we don't focus. If you focus, you can recover large number of patients. Every day I see one video from Philippines recovering one or the other case of paralysis. Why can't you do in India? I went Philippines only one time. You see what they are doing. You have to focus. Anyway, what is my headache? The slides are given, use it, and the video is given. You can take the snapshots. Slides cannot be given because there's no use of helping so much. But then, I have recovered more than 21 types of headache with the help of this pen. Within 2 minutes in our clinic, 1 minute, 2 minutes, without any dollar. People come with severe pain. I said, come. 1, 2, 3, 4. Pain gone. Even I sleep with one sedative. I take ketamine while I sleep. Even then they wake me up. With that I can recover you. You can understand. I take 1.5. So, recovery of pain is very easy. Recovery of paralysis is very easy. Only when you want to recover it very nicely. Those who have 70% attendance, they will get the certificate. Those who don't have, they will not get it. I don't understand what is the problem in learning. What is the problem in doing things? Rather than eating painkillers, too much antibiotics, too much this, exercise. I don't understand. Today, my patient lady could not walk. I saw her hamstring was too tight. Why? The physiotherapy did a lot of exercise. I went, I just massaged it with this pain, stimulated with this pain. Tuck, 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 in few of the areas. Patient is going runningly. While coming, she could not even walk. Today, I'll show you one patient who was having L3, L4, L4, L5, L5, S1 slip disc. And his pain is subsided within 7 sessions. He was immediately advised surgery. He is a practicing advocate of the High Court. One good news. Walid, Can you say them? I have completed 2 books. Can you show them the 2 books which I have completed?
Okay, so let me check for it. Sir.
Yes,
Walid,
yes.
do you have the Walid, do you have it?
Yes, sir, I have it in my other phone. Let me transfer and show them the books.
Can anyone show them the 2 books which I have completed? And these books are for free, those who can practice well. I'm not going to sell these books.
So where can we get a copy of this?
Madam, first of all, you must know how to use things in a way by which patient can recover. Reading books cannot recover. We have learned, we have practiced, then we know how to use it. We cannot write everything what we know. First of all, your hands-on patient should be very important. Otherwise, everyone can recover what? Do surgery from books. Why to go to China? Why to do a lot of practice needling? Why to study so much? Why do I need to do needles so much in my clinic? Why should I treat 120 patients a day? What will you understand? How is this? Where are the muscles? How to integrate? How to see how much this has come? You one muscle you bought 7, one you bought 6. The patient will become dumb. Yeah, this is the one of the book which I have written. And the other book? You must know neuroanatomy. You must know things. Otherwise, this book is waste. There are 2 books which I have completed. Already I have completed many books. I have written 45 books. Now I'm just completing things. After this heart attack, I'm little aware. So I'm completing things right now. Next. One more book is there, please. And then last one. This is the last picture. Click the last picture. Yeah, this one. Disease of the brain and spine. Transverse myelitis and all. You can recover. Sitting at home, reading 3 months, 2 months, starting practice won't recover the patients. We have completed 3 years. And then also we feel that we have learned nothing. After 50 years of medical practice, we still say we know nothing. You see, after 34 years of my practice, I thought needling it this year. It's so difficult. And how to stimulate if something goes wrong, I'll be in a trouble. Now I understood using this pen. While teaching you, I thought I understood teaching this, using this pen, pen is gone. Why should I take the risk of inserting a needle and creating a hematoma or something? And if something goes wrong, how will I manage?
Dr.
So, sir,
Sastri,
Yes, please tell me from Singapore.
yes, sorry. May I ask 2 questions?
Why not 5 questions?
I thought of 2 first. Maybe we start with 1 first. So
Okay.
my question is, could you explain why anger can result in some form of tension headache?
See, anger is the form of adrenaline. So whenever adrenaline level highs, it triggers the what? Certain hormones inside the brain, which triggers the headache. So the most important thing when you insert a PC6 heart 7, what happened? The tachycardia goes down and the heartbeat level goes down. The hormones which triggers the headache goes down and the pain is released. Headache is not because of one thing. It's not just because of anxiety. It is also because of the gut. The immediate thing of a physician is what? Not to correct the situation from which he has come. Immediately release the symptom, immediately release the quality of life.
Do you also mean anger management also?
Yes. Anger management is very simple. Breathing and this pain. Control the hormones. The anger management is gone. You see how much anger I had. You have seen my anger. Now you see how my anger is going down, 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 down. Still something is there, but it is much reduced.
That's good.
How? By using these pains. What you need is an impulse. So instead of creating impulse from needles, why don't I create impulse from the pain, which is calibrated with the pain? Our problem is we do not know the technical jargons of the medical science. So we are not able to recover the disease. Since I know the technical jargons, I can diagnose and it becomes very easy for me. Oh, it is a mandibular joint. So put one pain here, put one here. Oh, now you check how much pain. Sir, gone. Oh, go home. You seen yesterday I recovered one shoulder joint pain in just 5 minutes, 4 minutes. She was having severe shoulder joint pain. There's been reduced more than one patient has come from UK, although Indian Punjabi lady. She denied to have any treatment in UK. She came to me. Now 80% of the shoulder joint, knee joint pain has been reduced just by inducing 2 stem cell therapy and needle. Now you see how easy to treat a patient. Otherwise, continue to give anti-steroid medicines. What will happen? Side effects, and for long term, no effect. You eat today, after 6 hours you have pain. Again you eat, then Deflacort, all this, they destroy the body more than anything. So what is the second question?
The second question is, how will scoliosis affect headache also?
See, scoliosis affects because it's a change of direction of the spine. So the CSF, it affects the G lymphatic system and it affects various areas of the brain by which it triggers it. In a simple language. Because there is a nerve compression, because of nerve compression, a lot of trigger points are generated. Because of this trigger points generation, a lot of headache is generated. 70% of the headache is generated because of the trigger point. What do you call Ashipani?
Okay, so how can MIBS correct this or relieve?
Just put the pin. Muscle you have to learn. You have to learn all these things very carefully. It is a practical subject. In theory, you cannot learn how we can characterize scoliosis because it's a neurosurgical subject. Even through neurosurgery, it cannot be corrected. So can a neurosurgeon learn neurosurgery from Zoom? Huh?
No. Practical is needed.
Yes, whatever theory I can teach, which will help you, that I will teach. But whatever practical is practical is practical. You have to work months with the patient to know how it recovers. What are the difficulties you face in recovery of the patient? That is the most important thing. Your exposure to the patient is less. Our exposure to the per day, our patient is 120, 100. More questions? Say touching this pen here, putting here, then here, here. ear, ear, then ear, ear. Pain gone.
Thank you for the demonstration.
More questions?
Sir, concerning the pen, how about Indonesian?
Indonesian, how much pen you have to tell me. So then I contact the local post office. You have to contact them because customs are there. And then we'll find out the way. Because in Guwahati it was easy. Here I'll have to find out how to do it.
Okay, okay. I'll tell my friends, okay, and I'll tell you later on, okay? Thank you so much.
Yes. You can buy one pen also, you can buy two pen also, you cannot buy no pen also. My work
Okay.
was to do something by which people can recover patients without needling. Tomorrow the rules will be there that you cannot needle a patient like Italy and all. So what I foresee, today I went with this. At least in this practice, you don't have any side effect. You may not create any difficult situation and complication in a patient, right?
Okay, sir.
So finally, those who attend 70% of the attendance, please mark it right now. Take the pictures. Only they will be given certificates, otherwise no one will be given.
Excuse me, sir.
Yes.
Sir, please, what of US? How do we get a pen?
Funding for curious tours provided by contributions to the extension. Viewers like you.
We will send it by post.
Regarding cancer,
Huh?
we should go with the coordinators, so we know which people have.
Pardon me, Walid.
We earlier were given pens through coordinators so that we know people who have learned so that it doesn't go into people who don't know how to use it.
It is very difficult because we are here. We don't get time. Those who don't know how to use it, they'll create complication and they will not use it.
Yes, sir. That is why they should anybody who wants the pen should
So
talk
it is
to
there
their
is-
country coordinator.
No, it is don't take the responsibility on your shoulders. Otherwise, they will
Okay,
eat your head.
Okay, sir.
My first thing is that don't take the responsibilities. They want to buy directly. It has nothing to do with the. Some people were blackmailing me that they purchased this pen, now give me diploma certificate, fellowship certificate.
And they don't know how to use it.
They don't know how to recover a single disease. They don't know the anatomy of the brain and they want to recover that disease. So, not possible. No? You collect 200 students, then we will go with what? Microvascular surgeon and all. I will invite neurosurgeons, I will invite to take classes. We learn more from them. You only advertising in my group. You have to advertise in Facebook and other groups. You have to put my Facebook profile. You have to do some homework to learn something. So whatever you did not understand today, Ask me tomorrow.
Excuse me, sir.
Yes.
Good evening, sir. So do you have any video on recovery of brain tumor, sir?
See, brain tumor cannot be recovered. You can reduce the size. We have the data, but then I left Guwahati in a single night. So I only bought 2 shirt, 2 pen to Hyderabad. Everything is left in Guwahati. So I don't have anything here.
Okay, sir.
Any more questions? Any more questions? Any more questions? So I will be teaching you tomorrow some other points on pen therapy. Right?
Right,
You
sir.
learn,
Thank
you
you.
learn a lot of things. Write down. From the video will be given. Right? I was very fast because I have to complete a big chapter. It's generally taught in 5 days, or we take around 5 months to complete this chapter. 3 months to complete this chapter. I completed in 2 hours.
That's why you speak so fast.
Otherwise, you don't have time. You say 9:30, 10:30, 11:30. What I will do?
Yes, I understand. Thank you.
So the recording is there. Record here. Understand?
Okay, that's the recording is for.
Yes. Recording is there. Recording of the class you will get.
Thank you, sir.
Thank you, sir.
Thank you so much.
Thank you, sir. Thank you so much.
Thank you, sir.
Thank you.
Thank you so much.
Thank you, sir. Thank you, sir. Thank you so much.
Thank you, sir.
Good night, everyone.
Thank you, sir.
Good night, everybody. Shutting down class.
Thank you, sir. Thank
Good
you.
night, Engineer Wali. Thank you.
Thank you,
Night,
sir.
sir.
Thank you, everyone. Good night.
Thank you, Sir Wali.
Thank you, everyone.